Welcome to Second Opinion Stat, health information you can use anywhere, anytime. Brought to you by the producers of the public television series Second Opinion and the University of Rochester Medical Center. Here's your host, Dr. Peter Salgo.
I'm here with Dr. Howard Langstein from the University of Rochester Medical Center. Welcome.
Hi, Peter.
And New York dermatologist Dr. Doris Day. Welcome.
Hi, Peter. Thank you.
Simple question. How does the face age? And don't just say badly. Tell me what it is about the face that ages.
Well, there are changes to the skin and the soft tissues and the fat and the bones. So the aging process that you would think of things descending, gravity being relentless, it pulls down on the brow, the eyelids begin to descend, and the cheek descends as well. And then the bones over time do begin to change their structure and become less dense. And finally, the fat just sort of assumes a different position, giving patients jowls, the lower part of the face. But you've
talked about this appearance sometimes being an optical illusion, that what you think is happening really isn't what's happening below the surface.
That's true. We've learned so much about how the face ages and how to rebalance it over time. I look at it as two components of aging. One of it is genetic, and you have no control over that. That's what you've inherited over time. But the good news is when it comes to the skin, you have control of about 70% of how your skin ages. So by proper skin care and lifestyle changes, not smoking, getting enough rest, having a healthy diet, and of course using sun protection, you can keep your skin looking its very best over time. But we're no longer chasing lines and wrinkle. We're adding back balance and harmony and helping people look their very best.
People want to know, can they stop the aging process in the face?
You can't stop. You cannot stop it altogether. However, you can keep your skin looking its healthiest. You can optimize and you can enhance how your skin looks. And no matter where you're at, so no matter how much sun damage you've had, no matter how much exposure you've had, or how much damage over time, there's so much you can do right starting today to help your skin look its very best. Not only look healthier, but actually be healthier.
Well, let me ask you the philosophical question. Should we want to stop or slow the aging process?
I'm not sure that we should stop or slow it, but I think that if we have techniques that can make patients look younger and make them feel better about themselves, then I say go for it. We don't want to be 90 years old and have the face of a 20-year-old. That just wouldn't look right.
You know what, I have to disagree. I would. If I could have that healthy, beautiful, radiant, resilient skin at any age, that's my goal for every patient.
Well, then we have to rejuvenate the whole body.
Yeah, that's true. That's true. Well,
maybe you're showing your face to the rest of the world.
That's correct.
Right. So what they see is maybe the 20-year-old face.
Yeah. I think, as we talked about before, it's a matter of aging gracefully. Yes. And it's a matter of doing it with balance.
Yes.
And so I think slowing is the operative word, not stopping.
As a dermatologist now, a cosmetic dermatologist, what procedures do you have to offer people who want to slow or perhaps reverse this aging process?
So my goal is never to get rid of every line or wrinkle or to poof out the face like a balloon. And I think that's the difference between a 90-year-old and a 20-year-old. That's not my goal really, but to have beautiful, healthy skin. So I think that there are areas that we didn't look at before because we didn't have tools before to help those areas. If you look at the temples, the tear troughs that come down along the chin line, these were areas that we very rarely treated in the past, even in front of the ears. When you strategically place product, these are soft tissue fillers that are injected often deep into the skin, way under the skin, right over bone. You can actually add contours, balance, resculpt the face, not to get rid of everything, but to help it look its best. But you need proper skin care along with it.
It sounds almost to me as if you're putting silly putty under the skin and then sculpting it.
In some ways we are, but it has to be done strategically. I mean, look, we all look at people, their lips are way too big, their nasolabial folds are filled, and they're very full in the middle, but they still don't look right. So we don't want to be top heavy or bottom heavy. You want to have a balance, and that's how you really look good. This way people say, oh, you look well rested, you look happy, but you don't look done.
And how does the surgical approach differ?
It depends on what the problem is. And so if we start from the top, many people have descent or dropping of their eyebrows. Yeah. Those can be lifted up with brow lifting. Actually, a little temporary lift can be done with Botox sometimes. But the brows can be lifted usually through a small incision, and with a telescope, an endoscope can bring these things up. If you look at the eyes, which is the biggest bang for the buck, so to speak, the cosmetic surgery around the eyes. If you could remove the extra skin around the eyes and a little bit of extra fat, and sometimes just taking this fat and redistributing it in the tear trough that you mentioned. That helps smooth out that balance. And then the ultimate is the facelift, which means redistributing the deeper tissues of the face, usually a deeper layer, and then the skin layer, and those can be resuspended and brought back to where they need to be, and then extra skin is removed and redistributed. Oftentimes these procedures have addition of volume back in to put in to plump up the cheeks and to fill up fat, because fat equals youth.
Thank you both very much.
Thank you.
Thanks, Peter.
Major funding for Second Opinion is provided by the Blue Cross and Blue Shield Association, an association of independent, locally operated, and community-based Blue Cross and Blue Shield companies supporting solutions that make safe, quality, affordable health care available to all Americans.
Second Opinion is produced in association with the University of Rochester Medical Center, Rochester, New York.